Hello everyone, it's been quite a while since I last spoke to you and gave you an update on what I'm up to. The ambulatory oxygen I'm getting used to that now, which is kind of good. The stigma that I thought was going to be attached to it is now kind of dissipated, so I'm not overly fussed about it now, so I'm not worried what people think of me anymore. The only downside to it is the fact that where I live in a kind of small community where most people know everybody else, and I've been trying to keep my condition quiet from anybody, so not many people know that I've got this thing. But trouble is now, when I hold a tube in my nose and I'm walking around, people start to say, "Oh, what you got that for? What's happened there? What's happened there?" And you can't really not explain it. You've got to kind of give them an idea of what's happening. The trouble is, in a small community, word gets around, and that's the biggest downside to it, I think. Well, for me anyway. So whilst I've managed to keep it a secret for quite some time, it is obviously going out in the local community, which, well, it is what it is, I suppose. I have now been put on the, not put on the list, but put in the system for double lung transplant, and I've been offered a number of hospitals in order to do this. There's one in Birmingham, and there's Harefield Hospital and other such hospitals, but the only one that I've really got in my mind is Papworth in Cambridgeshire. And the reason that is because it's well renowned and world renowned, in fact, for transplantation and other things like cancers and stuff like that. So that's really my preference, and that's not really a detriment to the other hospitals that conduct transplantations. I'm not doing them a disservice. It's just that I've always had Papworth in my mind from the outset anyway. My blood tests are still continuing because I'm on mycophenolate and also the Nintedanib. Now, when I last spoke to you, I was having okay, it's only early days taking the Nintedanib, but now after about a week after I spoke to you, the diarrhea kicked in big time. And I put up with it for a couple of months. So I spoke to my doctor in Dorchester, and I asked him about the lopramide, lopramozole, Imodium, and he said, "Yeah, take it whenever you want to. There's no contradictions with the other drugs that you take." So my wife bought me a packet the other day. I haven't took them yet, but I'm sure I will do once it starts getting worse again. But that is a common side effect with Nintedanib, so most people get that. So if you are taking Nintedanib or just about to start to, just be aware that could happen. It is frustrating, but at the moment it's not debilitating to the fact that I think I don't want to go out because I need to go to the loo. I kind of clear myself out beforehand as best I can, and then try not to think about it. And then I do my day as I can. Now I work more administration as opposed to what I did before. It's quite easy for me just to nip to the toilet quite happily, whereas when I was driving tugboats, as you're the only one sat in the chair driving the tug, if you want to go, you can't just leave everything. That's the problem. But I no longer do that because of my health. So I'm more a desk jockey now, doing administration, which is a little bit of shock to my system, where I was normally out and about for the most of my life. In fact, all of my life, I've been very active out and about, and now I'm kind of confined to a chair and a couple of computer screens. It is what it is, so I'm not complaining. I have been undertaking pulmonary rehab courses locally. In fact, about a 10-minute walk really from where I live, so I'm kind of lucky in that respect. I was a bit nervous to start off with because I wasn't really sure what was involved, but I was referred to them, and they've been absolutely delightful, to be honest, for want of a better word. They've been really, really good. They're fun to be around. The two nurses are very fun to be around. We have a good old laugh and a joke. And we undergo exercises, a warm-up beforehand, of course, take your oxygen levels and your heart rate beforehand. And then you undertake different exercises such as star jacks and walk in, step up on, like the Chester test when you step up onto the block and step down, that sort of thing. And you do that for 2 minutes each time, and then you rotate for another 2 minutes doing something else, and then you rotate for another 2 minutes doing something else. So it's not all one thing, which is good. After you do those, you start doing some work with weights. So they put weights on your legs, and you just stretch out your legs with the weights on, sat down on a chair, and just basically you're strengthening every muscle you possibly can within your body, which really, really helps. And also, whilst doing that, it's giving you a lot of strength into your lungs, strengthening up them muscles around them and the heart muscles and as well, and also giving you a feeling of elation, I suppose, when you've completed it at the end. It's hard work for people with our condition, with your lungs. It's very hard work, but you gotta push through, because if you don't find it hard work, then it's not doing anything for you. So you've got to have the willpower to do it. So if you get referred to pulmonary rehab, they give you a choice. You don't have to go, but I recommend that you do, because it is really helpful. Well, it's helpful for me anyway. It's a good social aspect involved with it, because everybody that's in there are good fun. Surprisingly, most of the people that are in there are of a certain age, and most suffer from COPD due to years of smoking. I spoke to one of the participants there with us when we was waiting in the foyer, and she told me it's COPD down to her smoking, and yet beggars believe she still smokes. And I don't understand. I really don't understand it. I know it's a habit, and if you've been doing it for so long, if you've got a lung problem and your doctor says you got to quit smoking, you quit smoking. Jesus Christ, it's beggars belief sometimes. I don't understand people, I really don't. I've never smoked in my life, so can you imagine how that felt to me, somebody who's got a lung problem due to smoking, and they continue to smoke? Oh, it's so frustrating. Anyway, that's beside the by. So yeah, it's really good at the moment, the pulmonary rehab. I do enjoy it. You've got to do a 6-week course of it, so twice a week for 6 weeks, and then you're supposed to continue those courses, continuous things after you finish. But they do put you in touch with other places you can go, like gyms and other monitored exercise classes and things locally as well, which is really cool, I think. But it's really good. So if you do get a chance, have a go. If you don't like it, you can always say I don't like it and not turn up the next session. I spoke to Dr. Phillips again. I got again issues with my heart, which is a shame, but it's all part and parcel of your lungs, because your heart and your lungs are all one thing essentially. So if you've got an issue with your lungs, you do have problems with your heart. In my case, it's enlarged, and it's enlarged due to the fact that my lungs are not expanding as much as they should, which leaves the heart more space to expand, and that's what's happened. So that's being monitored as well. I had my lung function test again. I still haven't got a chance to video it for you. I'm sorry about that. I really want to, but I'm just kind of embarrassed to ask, you know. You know, nurses doing their thing, and you don't really want to impose on them. I should do really, but they might be fine. They might be fine. If they say no, I might feel a bit gutted. But if they say no, they say no. But I should try and get that done. I was thinking about doing the just videoing a bit of the Pulmonary Rehab course as well, but I didn't want to do that either because there's quite a few people involved, and they might not like to do that. So I'd have to ask like 12 people if I have their permission to video them. I don't think that's right. I don't think I would want to be videoed either. So that's why I didn't do that. Yeah, the Nintedanib is pretty harsh on your bowels, but is all right. My mycophenolate, when I see my doctor in Dorchester, because there's quite a period of time between seeing him, consultations face to face, it could be a couple of months. He has to give me my prescription for mycophenolate because your GP cannot give that prescription. So he has to give me a load of mycophenolate tablets, and when my wife picked them up the other day, it's like a whole sack full of mycophenolate, and she said that the pharmacists is all that scratching their heads saying, oh, we got to get them in, we got to have a flipping massive truck come and deliver them tomorrow. It's not that bad. But you know, some pharmacies don't allow patients to have that much, so I'm kind of lucky with our pharmacy really to actually let us have that amount of mycophenolate, and it's a lot because I'm on six of them a day, 500 milligrams each, so that's why there's a lot of boxes. That's it's a shame for the pharmacy, but okay for me. And I always say is thank God that I prepay my prescription, because it'll cost a fortune otherwise. If you do take more than 3 separate prescriptions of pills, then I recommend you do have your prepay certificate, which you can do online. Just type in prepay prescriptions, and they take you to the government website, and you can do it that way, which is what I did. Just got to blow in my nose. Sorry about that. Yeah, that's it at the moment. I can't have much left to tell you. It's nice to have a different view behind me, and I got my jumper on, which is a change from work clothes. It is a Saturday, so I'm home alone at the moment. My wife's gone elsewhere with my daughter and our pet dog Pebbles. Don't ask. She's a delight though. So I thought a little bit of scenery. I'm just trying to be cheerful, okay? I am essentially a cheerful guy. I try not to let this thing get on top of me as it gets worse. I just try to be as positive as you can, because you've got to. One thing I also have noticed that is because I'm osteoporotic, lower lumbar, which I've mentioned before, being osteoporotic could actually deter you from being suitable for lung transplantation. So I asked Dr. Phillips if I can cut down my steroid intake to try and alleviate that. But because he couldn't get my lung function tests on his computer, despite him asking a number of times to get the results to him, he couldn't give me a decision on that. So I don't want to be in that road where my only hope is transplantation, and then that only hope gets taken away from me. So what I've done is I've reduced my prednisolone intake myself without Dr. Phillips telling me. So It may be wrong, but I think it's the right thing, because I take three mycophenolate tablets twice a day, so they're probably doing the job for me, whereas the prednisolone is eating away at my bones. So what am I going to do? So I've tapered it down myself. So I'm on 5 milligrams a day now. So I may be naughty, but it's my body, and I think that's the right thing to do, because I don't want to have this lung transplant taken away from me when it comes to that stage. And that's it, really. Trying to keep fit, still working, still trying to be positive, and that's where we are. So thanks again for watching. Thanks for bearing with me, and I hope to update you soon when I have some news to give you. So thanks ever so much, everybody. All the best. Look after yourselves and breathe easy. Cheers.